Hello everyone, welcome back to another Cam Studio conversation. Today we are joined by four incredible people from Kosmoderma Academy of Aesthetic Medicine, fondly known as CAM. So let me take some time and introduce them. Dr. Nishta Patel, who is the head faculty at CAM, Ms. Kishori TA, Vice President of Kosmoderma Academy of Aesthetic Medicine, Jeffna Jose, who is also the faculty at CAM, and Dr. Soumitra Das, who is also faculty at CAM. Today, we are breaking down the future of aesthetic medicine, CAM's training standards, and how this field is set to explode in the year 2026. Okay, so let me begin with the first question. What do you see for the aesthetic business in the coming year?
Honestly, we have never expected this kind of growth and pace, especially after COVID. One thing we clearly understood during COVID is people want to look good, people want to feel good. They value self care more than ever.
I agree with you. Before COVID, the number of the clinic was not so much. But after the COVID, definitely the number of the clinic has gone high. And it's gone multifold, more than 10x time. If you see about that, it's not number of the clinics, it's the thing about the quality matters over here.
So, what I correctly understand here is if we see how India runs on tea constantly, if the chaiwala is really selling really good tea, the people go back to that person again and again to have some tea. So I think it's the same analogy.
Yeah, that's true. It's same in aesthetic as well. So there are so many doctors who does the short course in aesthetic medicine, but eventually they come back to the camp because they knows what quality training makes a difference. Our training schedules are like we provide a intense hands-on training, and that will be like a 10 days intense practicals, and later on our doctors shadows for almost 1 month, and in that they will see the real case decision, real case observation and decision making, and real injections as well. So here we are not conducting any one day kind of workshop. What we provide, it's kind of an intense aesthetic medicine program. That's what we provide.
Yes, so CAM doctors open up their clinics and run it successfully, and also whoever is looking for placement in the industry, they get placed very easily, and they're all doing great.
So, which means like I would love to come to the second question here. So, what do you see, like, where do you stand out? And what is that one USP if you want to put forth to the people about CAM? What would it be?
The biggest difference is the compact batch of course what we have. It's not 50% workshop, or it's not 1,000 person auditorium classes we have. We have very compact batch of, we cap it at 5 to 6 students, and it's a very intimate knowledge sharing sessions what we have here.
Of course, learning never stops after the 9 days or 10 days of the practical as well. So our faculties will be always connected with the students through a practical theory and even the post-clinical guidance. And we always will be connected with our students throughout of their life, kind of a nurturing of their life. And we always stay connected with them whenever they require our guidance for our students.
Well, anyone who comes out of CAM, actually everyone who comes out of CAM always says one thing, that they are overwhelmed with how nourishing and how personalized the training is.
What's the eligibility? Who can join CAM?
Okay, so we would love to train everyone, but right now at CAM strictly we are just training the MBBS doctors and dermatologists.
So, what about nurses and non-medicals?
Yes, we do. We have one dedicated course for the nurse for aesthetic procedures, where we train them for the procedures where they are allowed to perform and where they have to assist the doctors. So take example like a GFC procedure, where they're going to help to withdraw the blood, centrifugation and prepare the tray, and doctors will complete the procedure later on.
And for non-medical, we also train them on clinic support roles like, client coordinator and basic procedure roles, basic procedures like lymphatic drainage and other basic level procedures which they can do at the clinic. And there's a high demand in, for for aestheticians, medical aestheticians. It's a high demand role it is right now. And we do provide 100% placement for job placement for all of them.
We have 4 core courses at the academy. We actually tailor-made it depending on which can fit into their background of education. Like doctors get to do injectables, the dermatologists get to learn advanced procedures. Non-medical also, as she rightly said, that a lot of administrative roles and nurses. So it's like we train all 4 categories here.
Okay, so which brings me to my next question. What are the basic and advanced treatments doctors learn at camp?
Actually, anti-aging, which starts from HIFU and Botox and fillers. We train hydrofacials and MediFacials, which is very popular now. And when we talk about aesthetic lasers, everything from the basics, like laser hair reduction, skin tightening, skin lightening procedures, scar treatments, everything we teach here.
And anything which requires doctor intervention at any service related to the skin, hair or body, that's all we teach here at camp.
So we have all gone through this phase wherein we were going to a neighborhood salons, right? But today clients want, more doctor-driven skincare like red carpet facials and, more long-lasting results, right? In India, if you see, facials are like this every household ritual or rule. Everyone does it. So our core intent is that everyone should know that when it comes to skin and skin health, it should be done or treated or taken care by a trained doctor, right? We go to salons. We go to salons for pedicures, manicures, haircuts, hair colors. So, but anything related to skin and hair health should be handled by a dermatologist.
So it's like if you have fever, you don't go to a salon, you go to a doctor similarly. Okay, so which brings me to my next question. What modules and topics does the course cover?
Yes, at CAM, we train aesthetic medicine for doctors and nurses and non-medical as we discussed. It's a hybrid model of course what we have. So we have online and practicals and observership. So where we start with skin and hair anatomy and physiology, laser principles and laser physics. And then we go for aesthetic conditions for the treatment. And then when they come for the practicals, we start with basic chemical peels to advanced, and then all the lasers, glutathione injections and IV drips, and hair management, the PRP, GFC, and QR678 we teach them. And little more in depth of lasers is we start with laser hair reduction, scar treatments, MNRA, fractional laser, HIFU kind of advanced treatments. All of this end to end, we train them completely.
Yeah, and we do also teach them all the procedures hands-on, and all the students gets to do observership at all the Kosmoderma clinics.
Great. So I was wondering, so in India, as it's not prone to, Botox and fillers, they're not much used to it. When it comes to other countries like US or the Southeast Asian countries or Arab countries. So how do you see this trend going?
Sushant, if you see about this in US or Arab or any Western countries, even though they're Korean, they understand about this Botox and fillers from the childhood itself. They know about what is Botox, they know about what is fillers and what is the reason behind that, which are the indication they need to go ahead and do it. But in India, when it comes to India, Indian people are not so accustomed with the Botox and fillers. They don't know, they feel that still there is a kind of dogma that people is having a different thought process about Botox. They feel that these are toxins. But if you see about Western countries, they enjoy the toxins. That's the difference, right? And if you see about their culture and Indian culture is way beyond. So now down the line 5 years, if you see about the statistics of India, hardly Botox would have been sold over there 1,000 vials. Even though in case of fillers, more than 20,000 syringes. Now if you see down the line 5 years later, 2025 data, it could be in Bangalore, more than 57,000 vials are selling, right? So people are understanding now the way it has been accustomed with the clinic level, the way it has been percolated to the different level of the clinics. People started understanding why it needs. And people are now concerned about the beauty. They feel that yes, Now I have to look beautiful externally, and Botox and fillers is the only one options, right? So in CAM, we are not giving the training only for the anatomy. We are also giving the training about the product differentiations, right dose, right email to be utilized, right units to be utilized for the specific areas, so that every face should be a different face. If you see about the Western face, every face is almost similar face. But in India, specifically in CAM, we are giving the training what exactly need for that every face, a different kind of intervention, different kind of personalization, so that every face can differentiate than others.
Okay, so are there any international career opportunities for the students who want to go out and do the practice, or are there any like certification or extra skill set that the students have to do?
So yes, of course, aesthetic medicine is one of the medical field where the knowledge of aesthetic medicine is globally transferable, and treatments like lasers, chemical peels, injectables, and energy-based device where international standard protocols are followed. Because treatments like lasers, peels, injectables, and energy-based device globally follows the international standard protocols.
True. So the thing is that the laws are different in different countries. So the certification also be different from different countries.
So, everybody dreams of opening their own clinic, their own setup after they complete the course at CAM. So, how do you see this? What is your thought process behind this?
It's a very interesting question, actually. So we do have a business module where we teach the students. In fact, if you notice, at this point of time, all the doctors who's after PG, they started doing business management courses with IIMs and IBS and all that. So when we are setting up the clinic, we should think like a businessman, not just a medical expert there. So we do teach them where we actually give more emphasis to statutory, the business management, and how to operate the clinic, where to procure the equipments and consumables from, how to put a system, how to train the staff, because that's also very important. Doctor cannot be there always to look after the practice. There should be a system to run the whole show, and how to keep the pricing standards according to the industry, how to handle the client acquisition, how to retain the clients. There are a lot of things which we train the doctors. So it's part of the curriculum, and most of the doctors have benefited with this, and they have successfully opened the clinic and running it very well.
Thank you all for joining in. If you're looking to start your own setup, or you want to upskill yourself at CAM, or you're looking to start a new journey in the aesthetic medicine, we welcome you to CAM, and we want you to start your journey with us. So thank you so much for watching, and we will see you next time.
Thank you.
Thank you.